Infections can be costly for your practice. Patients' lives, your accreditation status, certification, and licenses are all at stake. Since 2001, at least 50 outbreaks involving unsafe injection practices were reported to CDC, and 90% of these outbreaks occurred in outpatient settings. Hundreds of patients were infected, and over 150,000 patients were notified and advised to get tested for hepatitis and HIV. Does your team of nurses and physicians use single-dose and multi-dose vials properly? Misuse of medicine puts your practice and patients at risk. Educate your team and consider these questions. Do you have enough supplies to ensure safe injections? Syringes, medications in correctly sized vials, and personal protective equipment such as gloves and face masks should always be available. Is your medication preparation area separate from the patient care area? Facilities should have a designated clean medication area where injections are drawn up and labeled immediately for each individual patient. This space should be away from patient care areas and away from used or soiled equipment and materials. Are you purchasing the safest available medication? Think about safety over cost when you resupply clinic medications. Request the smallest vials that meet individual patient needs. Use FDA-approved and regulated drugs. They are the safest drugs for your patients. Consult with pharmacists and others to learn whether pre-filled syringes or other ready-to-deliver unit dose packaging is available. Do you provide infection control training for your healthcare personnel? Along with OSHA-mandated bloodborne pathogen training, infection control training on safe injection practices should be provided upon hire and at least annually for all healthcare personnel. Following and implementing basic safe injection procedures is not something to take for granted. There's too much at stake. Educate yourself and your team. Imagine if it was you. At the end of the day, we're all patients. Do your part to make healthcare safe, one injection at a time. One needle, one syringe, only one time. Learn more about safe injection practices and download free resources at oneandonlycampaign.org.